This week marks 20 years since the passing of NYPD Detective James Zadroga. The 9/11 first responder died at the age of 34 from a respiratory disease attributed to toxic exposure from Ground Zero. A federal bill in his name, signed in 2010, provides medical treatment to survivors and also created a victims' compensation fund. And as Lisa Rosner reports here tonight, his illness is still changing the lives of hundreds of thousands of people connected to this tragedy.
Leah Betso says her late father, NYPD Officer James Betso, was supposed to be off September 11th, but rushed to Ground Zero when tragedy struck and continued to work there for months.
He loved the police department and his country.
He retired the next year, but in 2012, she says he had a seizure.
And then they found the tumor in his brain. It was the glioblastoma. My dad was a really tough guy, and we took it day by day.
She says because of the James Zadroga 9/11 Health and Compensation Act, he was able to connect the illness to 9/11 and get treatment until his death 3 years later. Attorney Michael Barasch helped push for the bill's passage in 2010 with the Zadroga family. He explains how NYPD Detective James Zadroga's autopsy was pivotal for thousands of people like Betso.
A 34-year-old man shouldn't die. He was totally healthy before 9/11, and in the autopsy, they found ground glass in his lungs. We were able to use his autopsy results to convince NIOSH, the National Institute for Occupational Safety and Health, to link all these respiratory illnesses and now 69 cancers to the World Trade Center toxins. Detective Zadroga's daughter, Tyler Ann, has been with us to Washington to help lobby for the full funding of the World Trade Center Health Program.
Today, Leah Betso works at Barasch's firm, which helps 9/11 survivors and first responders. Through tears, she says this work is in honor of her father as she recalled his last days.
And it was tougher to communicate with him, but I know that, right now in the position that I'm in, I know that I'm making him really proud.
While a lot of progress has been made since Zadroga's passing, Barasch says they still have to go to Capitol Hill to fight for more work to be done.
The health program needs more funding. And if they don't get that funding, they're in danger of not being able to take more patients after 2027.
He says the 9/11 Responder and Survivor Health Funding Correction Act of 2025 needs to be attached to the year-end budget, and the deadline for Congress to vote on it is this month. In Lower Manhattan, Lisa Rosner, CBS News, New York.